Zero.
Dear friends, I have great pleasure to greet you all during this when we are gathered here to celebrate the 75th anniversary of the World Federation for Mental Health in Geneva. I had wished to join personally, but due to unforeseen circumstances, I am unable to be here. My greetings to all of you from the Asia Pacific region. I would like to highlight two issues here. One is the mental health advocacy issues specific to the Asia Pacific region, and then I would also like to summarize some of the recent regional initiatives in this area as the regional vice president for Asia Pacific region. I am Roy Abraham Kalivaili. Mental health issues, advocacy issues are numerous here. I would say that the poor investment in health and mental health is one of the most pressing problems in our area, in the Asia Pacific region. As we all know, most of the Asia Pacific region, the investment in mental health is just 2% or less than 2% of the health budget. This is a very abysmally small amount, and this has consequently led to poor infrastructure, mental health infrastructure in the countries in the Asia Pacific region. Even for a huge country like India, we have 1.45 billion people live. We have just 7,000 psychiatrists, which means one psychiatrist has to take care of 200,000 people. Similarly, if you take the number of clinical psychologists, psychiatric social workers, mental health nurses, and other community workers, numbers are even fewer. So this is one major area we are finding it difficult. We are trying to convince the governments. We need the support of the WHO and the World Federation of Mental Health to make the governments in the Asia Pacific region to spend more money on mental health. We also have a big problem about the stigma which we are facing this here. The stigma is definitely widespread. Of course, with the increasing literacy, but it is different in different regions. For example, I come from Kerala in India, southern India, where the literacy rates are very high. The stigma is much less. People are accepting mental health as an important part of their daily lives. And another important aspect apart from stigma is the poor training in mental health given to the mental health professionals. And also poor training in psychiatry. For example, in India, they train something like 140,000 medical graduates in a year. But they have no good training in psychiatry. For example, there is no examination to pass the MBBS degree course. So consequently, because there is no examination, the people do not take up the subject seriously. And this is one area we would like to have better training for our graduates and our other mental health professionals. Similarly, we speak about mental health in primary care, but the primary care is already heavily burdened. So we are unable to do, our primary health doctors are unable to take care of the mental health problems as well. Now I would like to summarize some of the recent regional initiatives in the Asia Pacific region. One of the foremost has been our associate collaboration with the non-government organizations, or what WHO calls non-state actors. We have been able to involve with a number of NGOs in this area, in the Asia Pacific region, especially in India. We have been collaborating with some of them with excellent results. And during the celebration of the World Mental Health Day, we have honored them by giving the World Federation of Mental Health Asia Pacific Awards. Similarly, we have also honored some of the journalists who have worked very hard to propagate mental health. One of the areas is we have another important initiative we have made was that making the World Mental Health Day celebration as a major public initiative. This year in the Asia Pacific region, it was celebrated in India, but the Indian Medical Association, President of the Indian Medical Association himself came over and inaugurated the event. This was followed by a public rally in which all the mental health people, all the people associated with mental health participated. There was a mental health exhibition. There was a theme symposium on mental health as a universal human right. And there was much discussion. There was a special session for carers, families and users. So we are looking forward to work put together with the users, families and all specialists in this whole area and work together. I would like to especially may thank the President, Dr. Nasser Losa, and the Secretary General, Dr. Gabriel Yupcharo, and all my dear colleagues in the WFMH board for their support and cooperation. Thank you very much.